Midwifery is about supporting women and their families through their journey to parenthood. But what does a family look like? The idea of family has evolved, and as midwifery students and advocates, we need to ensure that maternity care is safe, inclusive, and respectful for everyone, regardless of their background or identity. In this video diary, I reflect on how midwifery care supports diverse families, particularly LGBTQIA+ parents and culturally diverse communities, while examining the challenges that remain. One of the biggest barriers to equitable maternity care is the persistent discrimination faced by LGBTQIA+ individuals. While there is a growing awareness of inclusivity, healthcare environments are still largely shaped by heteronormative assumptions, leaving LGBTQIA+ parents feeling unseen or invalidated. Highlighting the importance of gender-affirming language and specialised training for healthcare providers is this study by Sheriff, examining lesbian and gay women's experiences of midwifery care. One person was documented as saying, "My baby was put on my chest and the doctor would ask if dad would like to cut the cord. My partner's face dropped and she looked so embarrassed." Incidences like this show why inclusive language is essential. It isn't just about being politically correct, it's about ensuring people feel seen and respected in their most vulnerable moments. Transgender and non-binary parents also face significant systemic challenges in maternity care. Misgendering, lack of healthcare providers trained in gender-affirming care, and inadequate access to fertility support all contribute to negative healthcare experiences. As midwifery students, we are taught the importance of woman-centered care, and I think that part of this means shifting our approach to ensure that every individual feels seen and respected. Beyond gender and sexuality, cultural identity plays a huge role in shaping how pregnancy and birth are experienced. Birth isn't just a medical event. It carries deep cultural and social significance, particularly in Indigenous and migrant communities. For instance, Indigenous Australian communities emphasise a connection between birth, land, and ancestry, yet Western maternity care models often fail to accommodate these traditions, making birth feel disconnected from culture. Studies including Brown's research on cultural safety highlight that integrating traditional practices, such as upright birthing positions or the presence of elders, can significantly improve maternal outcomes and strengthen trust between midwives and families. Despite conversations around cultural competence, I've noticed that it often remains theoretical rather than fully embedded in practice. During placement, I've seen situations where Indigenous birthing traditions are acknowledged in discussion, but not actively incorporated into care plans. Likewise, language barriers continue to be a major issue, where families are struggling to access interpreters or culturally appropriate resources, making maternity care feel alienating rather than supportive. There's a clear gap between policy and practice, and midwives have a responsibility to bridge that divide. The emotional and mental well-being of birthing individuals from marginalised communities is another area where maternity care often falls short. LGBTQIA+ parents, single parents, and culturally diverse families frequently encounter additional stresses, including societal stigma, lack of familial support, and financial constraints. While midwives are trained to provide holistic care, specialised mental health resources for these groups remain inconsistent. Trauma-informed care is widely recognised as important, but many maternity settings lack the infrastructure to implement it effectively. If midwives truly want to support all families, there needs to be a stronger emphasis on providing accessible mental health services, peer support networks, and culturally responsive counselling. Across this subject and perinatal mental health, I've explored the ranges of different support services that are local to me and how as a midwife I can encourage women to seek support to meet their individual needs and circumstances. Through my midwifery education and through my placement, I've seen both progress and persistent challenges in supporting diverse families. While inclusivity is often discussed, maternity care systems still fail to fully accommodate LGBTQIA+ parents and culturally diverse individuals. It is not enough anymore to acknowledge diversity. We need to challenge biases, advocate for meaningful policy reforms, and ensure that care is genuinely affirming, not just performative. Midwives play a crucial role in shaping maternity experiences, but we work within a healthcare system that still has significant shortcomings. As I continue in my studies, I hope that I'm able to critically engage with these issues, question outdated practices, and push for more comprehensive approaches to inclusivity in midwifery care.